Oh, we're already recording. Fantastic. Welcome back to the Health Revival Show. Almost said the food code.
Yes.
I like our new name.
I do too. Well, I want new pictures.
Yeah.
Liz and I have had many photo shoots in our day, and throughout most of them, one of us was either postpartum or pregnant or at the beginning of a weight loss journey. And we have never coincided our photo shoots to where we're like both in a really good state and really happy with things. And
We'll do it this summer.
we'll do it this summer.
Yes.
Bangin' bodies.
Yeah.
Bangin' health. That should be the name of our podcast, Bangin' Health. Just saying. We just rebranded. We're not doing that.
Yeah, we're not rebranding. Yeah. So like, welcome to the Health Revival Show. If you don't know, we're Liz and Becca, board certified functional practitioners, and we have a team at FitMom Functional Health that serves women around the world. So we normally have a lot of chitter chatter about our lives because we think that you guys care so much, which we know that most of you do. Some of you are like, yeah, we don't care. But that's okay. You're here for the functional education. Sometimes you get a little bit about us and our family and our crazy kiddos. I'm a boy mom. She's got one of each. Taylor is giving her the run for her life right now. But
I had to have a talk with Taylor last night
Oh,
because she is not nice to my husband.
Mm.
And Nick wanted to go lay with her in bed because she only wants me to lay with her at night and put her to bed. And she like runs away from Nick and comes to find me in the house if he tries to put her to bed. And last night I laid with her for a couple minutes and then Nick came in and he's like, all right, my turn. I get to lay with you. And he leaned down to like give her a kiss and she took his face and shoved his face away. And then I left and I was like, no, you got to let Dada lay with you. And so Nick came downstairs like 60 seconds later and he was like, she basically pointed to the door and told me to leave. And so
She's 3, you guys.
she's 3, by the way. So I had to go up there and I was like, Taylor, and she was just sitting up playing with her dolls because she has been hard to put to bed lately because she's on the, like at school, she still gets a nap.
Mm.
On the weekend, she's much easier, but during the week, she like doesn't, she's not tired. And so I was like, Taylor, you need to be nice to Dad. She's like, but I like you.
Mm.
And I was like, I like you too, but you need to, Dada loves you and you need to be nice to him because he loves you and he will give you whatever you want if you're nice to him. I was like, she's like, but I want you to lay with me because I like you. And I was like, I know that, but you love Dada too. And she's like, but I like you. And I was like,
Okay, we're not
just
getting
say
anywhere.
you love your father. Like, and so I was like, you got to be nice to Dad. Okay. Like, okay. And I came downstairs and I was like, I told her that she needs to be nice to you. So hopefully in the future, I will keep reminding her.
Oh, I feel like it's normal for a child to gravitate towards one or the other. It's really sweet when Marcus, because obviously with Ethan and like going upstairs early, he lays with Art and they usually like fall asleep on the couch and then he puts him to bed, which I don't think that's going to last much longer because he is so tall and so heavy to get from the couch to the bed. And it reminds me, my brothers used to fall asleep on the couch and my dad. So they were big boys. I love you, both of you. If you're listening to this podcast, I don't think they listen to it, but he would walk them to the stairs and they would be like sleepwalking and he would have to say like, okay, step up, like trying to get them up to the bedroom. But it's just, you know, sometimes
I can barely
he's like,
pick up Carson anymore.
yeah, sometimes he's like, Mom, I want you to lay with me. And so I'm like, okay, you know, it's like trying to balance is so hard.
Carson loves Nick, which is great.
Yeah.
Yeah, he always has. But Taylor, we're waiting.
It'll happen. It'll happen. One day you will come down on her and then she'll decide that she's flipping on you and she's going to, because he'll give her anything she wants and you won't. So, all right, we have to dive in today. Vascular integrity is what we're talking about. And I wanted to talk about this because we obviously work with a lot of women in menopause. And beyond that, we work with a lot of people who have a lot of chronic illness because of underlying things such as mold toxicity, heavy metal toxicity, infections, inflammation, autoimmune, you name it. That's what we deal with in our practice. And we do pride ourselves on working with very complex cases. So if that's you and you're like, man, I have been struggling with some of the things that we're talking about today, book a call with our team. We're happy to help you. We are always about getting to the root cause. My goal is to test and address. I don't want to guess. I don't want to do any guesswork, right? I want to also understand and have you understand that just because a test says something doesn't mean that that's a root cause. So I was actually having a conversation with one of our clients this week, and she's like, everybody keeps asking me what my diagnosis is. And I'm like, this is tough because she has so much going on. We've identified a lot of gut infections. We've identified mold toxicity, environmental pollutants, which we're going to talk about today's podcast too, that are ultimately placing a heavy burden on her body. And she's very inflamed. Over the years, she underate and she overtrained. And so she came to us very bottomed out hormones, cortisol, thyroid, very, very low functioning, Hashimoto's we identified for her. So a lot of things have been going on. And it's like, people want a diagnosis. It's not a diagnosis. Like, we're here because we're identifying multiple things because all 11 systems come together on one umbrella known as your body to create the system that you have. And it's not as simple, like, as just one thing all the time. Like I always say, it's never just a gut issue. It's never just a hormone issue, right? Like the chain is broken. You got one link that's off. Everything else is crumbling. So part of that is vascular integrity. And a lot of people can come in feeling high blood pressure or having a lot of migraines, never know like where this is like stemming from, never had these things in the past. And that's what we want to kind of talk about today. So first, what is vascular integrity? Like, let's just say this because maybe people like, what is this terminology? So this refers to the strength and flexibility and proper function of your blood vessels. So we don't want our blood vessels, our arteries, our capillaries to be leaky. We don't want anything to be leaky. Like we have all these different built-in systems, right? People hear the term leaky gut. Essentially, that's permeability, inflammation, the mucus layer has been degraded, you have holes here, so now things are getting into the bloodstream. What you don't want is for that to happen to your, your vessels. So we want to maintain their integrity, their structure, resist damage, and regulate the movement of fluid and nutrients efficiently. This is really important. And so when this is compromised, what happens? We have leaky blood vessels. This is more systemic inflammation. We have poor circulation and we have excessive clotting that can start to occur. And so this is where we start to see what you might hear in conventional medicine as high blood pressure, edema, varicose veins, and even cardiovascular disease. We're going to do another podcast on what your skin can specifically tell you about your cardiovascular health. But this is really important because the oxygen delivery, the blood flow, inflammation levels, all are major players with things like headaches and migraines, especially when things become weak, dysfunctional, right? Headaches become more frequent and more severe. And so we're going to talk a little bit about different signs and symptoms beyond headaches that can give you kind of an indication that this is something that you need to be concerned about.
Yeah, and this happens a lot in menopause because estrogen's a really important player when it comes to your elasticity. I always say like it makes you nice and lubricated. Like it helps with your bendiness, right? And one of the biggest reasons that I care so much about this is we've done some podcasts on cardiovascular disease. One of the main risks of a heart attack and a stroke is that the arterial wall is not strong. It's not thick and it's not, essentially durable. And so then the little lipoproteins, they always say that heart attacks and strokes are blockages. They aren't blockages, they're rupturings. They're rupturings of the arterial wall. And so it is so important for that arterial wall and the arteries themselves to be strong and durable, because then they can endure and sustain things and not create that situation as much. And so when estrogen declines, blood vessels essentially lose their elasticity and circulation then suffers and inflammation tends to creep in a lot of times. And this is why menopausal women have the higher risk of cardiovascular disease and poor circulation and things like brain fog and fatigue. And so estrogen does a couple of things. Does maintain arterial health, so helps with arteries being flexible and reduces inflammation, essentially crucial for atherosclerosis prevention. But then it also inhibits vascular smooth muscle cell proliferation. So it helps prevent basically the proliferation and migration of smooth muscle cells within those arterial walls. So it keeps the integrity, reduces the risk of plaque formation and vessel narrowing that can start to happen, okay? So the impacts of menopause, if not addressed properly and if not replacing what you're losing naturally, because everyone loses estrogen. And the thing that I get so frustrated with are these people on social media that are like, you don't need hormones if you're healthy. I'm sorry. Okay. Everyone experiences hormones differently. And when you lose them, you can have yes, night sweats and hot flashes and all the symptoms that a lot of people get. You can also have debilitating anxiety. You can have extreme lack of motivation to do things. The way that a lot of people explain it is like, I literally feel like I want to leave my family. Like that is the type of mood shifts that can start to happen during menopause when you lose estrogen. Insomnia, you can experience awful pain because, again, estrogen is that lubrication, right? It's that elasticity. So the cartilages then start to suffer, the tendons start to suffer, the muscles start to suffer. And so
hearing loss, tinnitus, fluid behind the ears. Like there's so many things that people don't correlate. I was talking to my sister about this morning. She's the one who inspired this podcast because she's been dealing with migraines that have progressively gotten worse and worse. And they've tried so many different medications. Thankfully, she's going to a headache clinic, and I've been talking to her about some things too. And I hope that she can get some answers. But she's like, I agree with you that this has got to be hormone related because, so much of this kind of aligns. So anyways, outside of, her situation, we do see I see a lot of ear issues with menopause ladies in our practice, and all of them have very low estrogen. And the really hard part that is frustrating, and I think the tides are going to be turning here, especially with like Dr. Mary Claire and some other, I think Naomi Watts is another one, that are kind of really coming out and saying like, we need to do better. We need to do better for women because women ultimately get to this place where they look at themselves and they don't even recognize who they are. And that's really scary, right? Especially if they're really depressed. We know a lot of people in perimenopause. What's the statistic for divorce? Like it's pretty high.
The statistic for divorce is highest in perimenopause. Basically, like the rate of divorce timeline wise in someone's marriage happens the most during the perimenopause years.
And Dr. Mary Claire did a reel, it was a few months ago, but she basically somebody had commented like, well, I don't have any of the symptoms and I'm in menopause. And she's like, great. You're part of like the 10 to 12% that thrive and don't have issues. But the other 88 to 90% of us are experiencing at some level symptoms that we could improve if we were to replace what's lost. And so again, we understand that people have this fear of estrogen because they think that breast cancer is solely estrogen. They don't understand how that actually happens. And what I was explaining to my sister this morning is that most people with breast cancer get it after menopause, right? And so estrogen does have protective compounds. Now, if you have the BRCA gene, you have, other things going on, then you might not be a candidate for estrogen.
Or use topical estrogen. That's not a systemic, right? Use vaginal estrogen or an estrogen cream, which doesn't get systemic. So it doesn't have the same type of effects, but it can still benefit a lot of the symptoms like the vascular integrity and the atrophy that starts to happen in the vagina and in the labia, because no one wants painful sex. Like, let's be honest, no one wants to have intercourse when it hurts. And so there are options. If you do have the BRCA gene or the history of breast cancer or whatever's going on, you can do an estrogen cream, which is safer technically, even though estrogen is not unsafe. Read the book Estrogen Matters. It's a great book. Dives into a ton of detail around all of the benefits of estrogen. And another reason why people that may not have symptoms during menopause does not mean that you don't need estrogen. Like the cognitive decline that starts to happen without estrogen and the higher risk of Alzheimer's and, Parkinson's or just a horrible brain fog, like a brain fog that just completely debilitates you, can be low estrogen. Mm-hmm. And so there's some other pieces that we want to talk about on top of just estrogen though, because yes, estrogen is a structural thing. Like you can't out supplement estrogen. If you don't have estrogen, you need estrogen. Like there's not much else. You can do a lot of other things and you can create an environment that's optimal, but you may still just need estrogen. Like it's
yeah. I mean, you can do all the things with your diet in terms of good quality fats and adequate nutrition and those things. But like, if you can't build the hormones, like you can't build the hormones, you can't build them without the cofactors. But if you do have the cofactors, sometimes it's not enough.
Well, yeah, your body's offline. Your ovaries ain't doing it anymore.
Right.
So okay, we want to talk about other exposures too.
Yes. I was going to say first, before we go into that, other things besides menopause, I want to talk about what are other visible like signs that can happen besides we mentioned headaches and migraines. So easy bruising, right? So blood vessels break easily. This is going to lead to unexplained bruises. Like you didn't even hit yourself that hard. Spider veins, varicose veins, slow wound healing. We look at tiny red spots on the skin, petitché. So small capillary leaks cause like the pinpoint bleeding. We can see this a lot in facial, right? Circulatory issues, so cold hands and cold feet. This has to do with NOS2, our nitric oxygen. This would be related to things we're going to talk about in terms of what you can do about it. Edema, swelling in the legs, numbness or tingling. We think about cardiovascular symptoms, as we talked about. So high or unstable blood pressure, dizziness that can go hand in hand with frequent headaches, fatigue, brain fog, memory issues, nosebleeds, bleeding gums, all the things here. When our vessels are weak, this is where things are going to break, right? And so outside of menopause, what other things can impact the vascular integrity? BPAs. Plastics. Have you guys seen on social media? Is it just maybe my algorithm that's like blowing up right now? I've done some reels on this in terms of thinking about, tea bags and what are our exposures to plastics, right? The biggest thing is if you're drinking out of plastic water bottles because you're a snob like me and you only drink filtered water, awesome. But what we would recommend is take some sort of water bottle with you, like a stainless steel. We love Clearly Filtered. They have some ones, they actually have children's stainless steel bottles now. The thing there is you don't know how many times that bottle has been heated and cooled in transportation, right? Moving through different warehouses, trucks, whatnot. So that is something, because the more that plastic is heated, the more it's going to enter into the food or water, right? Leach into that. So this impacts the endothelial dysfunction in terms of the thin layer of cells lining the blood vessels. So we want this to be flexible and responsive, but BPA disrupts the nitric oxide production, which is essential for blood vessel relaxation and circulation. This also goes back to what I think of NOS2, the gene. Cold hands and cold feet are one thing, but nose, that's one thing I see very commonly with people, including myself, who have blocks. I have a full block in my NOS2, nitric oxide. My nose gets really cold. Like my husband's like, "What's wrong with you?" I'm like, holding
I
my
always see your
nose.
nose gets like runny because I feel like it's always full. It like drips.
But I'm like always like at nighttime, like holding my nose like this. And I'm like, I don't want to suffocate myself, but like my nose, and not all the time, but, certainly in different seasons and obviously like in the wintertime. Anyways, we can also have increased oxidative stress and inflammation from the plastics. We look at arterial stiffness and atherosclerosis. Studies have actually shown that BPA accelerates the calcification and plaque formation. Get it out of your life. Like, do an evaluation. Like, are you getting food delivery services that have frozen meals, but it was put into that plastic container when it was hot? Are you using this for leftovers? Like you had dinner and it's still hot and you're putting it into a plastic container. Use plastic containers if you want, but just don't microwave them and only put cold foods in them. Try to switch everything over to glass. I would minimize the amount of plastics that you're doing. I was listening to Dr. Rhonda Patrick and Chris Wilkes, and they were having this conversation, and I was like, okay, so if you guys are watching on Spotify, because we're on Spotify, here's my Starbucks cup, always iced. And he was saying that he's really in love with Dutch Brothers coffee right now, and he was watching they do stainless steel to plastic. And she's like, I wouldn't freak out so much over that. Like if you were doing, because sometimes if you do Americano, right, they're going to put the hot into the plastic. She's like, that's like a quick exposure because it's then coming in over ice. What really is harmful is the time and temperature and like the reheating and everything. So, obviously you want to try to minimize that anyway. I don't think you have to go super crazy insane, but a large part of BPAs is how we detoxify them. All the studies that's come out, I did the reel about this when I talked about the tea bags. They're finding within the brain, there's about a credit card full of plastic per week is what they're seeing people are being exposed to. They're seeing it in placentas, fetuses, umbilical cords, all the things. So anyways, BPAs. Then we're thinking about heavy metals. So lead, mercury, cadmium, arsenic. Lead depletes nitric oxide, increasing blood pressure and arterial stiffness. Mercury increases oxidative stress and inflammation. Mercury toxicity is no joke, right? This is really, really important, especially if you have a lot of dental work that's been done. Try to get those amalgam fillings out of your mouth, working with a biological dentist. These are things that essentially are like a slow leak and trigger to your immune system. And we do see for people who are chronically ill and just they're doing the protocols and they're not getting better, there's some sort of dental or sinus infection that is just constantly triggering the immune system. It can be other implants, hip implant, IUD, breast implants, whatever. But a lot of times, mercury toxicity is impacting this as well. So we also see this in terms of vaccines. I'm not here to debate you on vaccines, but there is plenty of research out there about mercury and what it's doing to focus and brain. I don't want to, go down the rabbit hole of ADHD and autism because people will, get crazy over this, but just read the research. That's what I would say.
And it's just a lot think about the size of the human that it's going into, right? And that's the main thing is their immune systems are just not developed at that time. I waited until Taylor was 3 to get some of the most necessary ones that like she couldn't be in school without.
Yeah.
Because unfortunately our school does have some rules against it. So I waited and I pushed back as long as I could. And there's a lot of research that seems to show on certain ones too. And then I spaced them out.
Yeah.
So like she's 3.5 now. I know her body can handle it a lot better. Her immune system's more developed. So it's, again, we'll probably do another podcast with an interview in some point in the future. Someone that's a lot more of an expert than we are, but yeah, it's just a lot on their little bodies. So phthalates, continuing personal care products is phthalates. Mm-hmm. So thinking about, your hair care, your skin care, your perfumes, think anything that is scented, right? Any fragrance, you don't want to see a fragrance as an ingredient. Find the good organic candles, looking for the better quality, if self-tanners and, whatever you're using on a consistent basis, like your makeup, your, hair care, stuff like that.
Scan it. That's the easiest thing to do, right? EWG has some great resources. Yuka, there's a lot of apps out there. Mm-hmm. Yuka's free, but there's a lot of other ones that you can utilize too. Yep. Toxic something. I don't remember what it's called, but just scan these things. A lot of them are going to say paraben and phthalate free or something along those lines. Yep. But the level that we're exposed to toxins in our environment now, it's like 700,000 toxins and chemicals between like your, air, water, all the things. And then the last one here is glyphosate, which is next. If it's not still number 1, it's number 2. I believe it's still number 1. It's sprayed all over our crops and it increases oxidative stress, inflammation, disrupts your gut health, the lining of your gut, leading to endothelial damage. It's been linked in research to heart disease, stroke, and metabolic dysfunction. So, a lot of these things, it's like, what do we do? The same thing applies here as a lot of other podcasts. Good air quality, good water quality. Buy the Dirty Dozen, Clean 15, wash your fruits and vegetables. I like the Truly Free Veggie wash. I've been using that, or my ozone bubbler, because that will take a lot of this stuff off. Make sure that, you're avoiding fluoride. Fluoride is a big source here too. It's in our drinking water. It's in a lot of our toothpaste. The dentist, oh my God, this kid's dentist that we have for Marcus, like I already got into it with her about fluoride. And then she, again, with Art, like got into it about fluoride. I'm like, lady, like, how are you a dentist and not up to speed with all of the things?
They have very strong opinions about fluoride.
I have very strong opinions.
Also, high dose antioxidants, because we are exposed to things regardless. You're exposed to things that are going to cause oxidative stress and reactive oxygen species, and these things that can just spew inflammation and cause this just really unhealthy state of the body. So what do you do to combat that? Antioxidants combat that. So things like beets, dark leafy greens, vitamin C in high dose, vitamin E, glutathione, CoQ10, high dose EPA, DHA, and omega-3s. Like Mediterranean is, again, an amazing option to kind of, go in and out of because of its high levels of antioxidants. And then looking at all of your exposures, right? Supporting detox pathways so these things can clear. This is why we love genetics. And again, we do genetics testing as an option with just a genetics test and an analysis, because you may have predispositions. Some people have high sensitivity levels to NAT2, which is basically how you experience toxins. Some people don't process toxins well, and so they build up easier. And then other people, or the same person, may not create antioxidants well or turn on antioxidant pathways well in the body. So now you have a double whammy of all of the things you are exposed to, your body's super sensitive to and builds up, and you don't metabolize them well. And then you don't produce antioxidants to help clear them. So you might need a lot of exogenous antioxidants in the body, like those vitamin C, sulforaphane, leafy greens, Collagen's great because it helps maintain and rebuild vessel walls. So we see this. I mean, like there's research that shows collagen, when you take it, it's found in skin and hair and nails. Like it works if you're in type 2 collagen. That's typically the best form. There's too many types of collagen, so you want the good ones. Collagen peptides tend to be the best options. Red light therapy can be really helpful. We love the Cure U. We'll link that out as well. It improves circulation, blood flow, mitochondrial dysfunction, and then moving daily, right? If you are not moving, your blood is not moving well. It needs to be a supportive thing. So we highly recommend your 10,000 to 12,000 steps a day, your strength training, all of the things that help keep the integrity. People that are strong and exercise regularly, much harder to kill. Okay. They don't get disease as quickly or as easily. So there's a reason for that, because it helps keep things moving and detoxing throughout the body. So yes, again, estrogen may be necessary. We're never going to forget that or not mention that, because in postmenopause, you just don't have it produced. You aren't producing it at certain levels. And so you may need it because it is such a big player with all of this, but doing all the other things, looking at your exposure, all of that is going to be necessary, because this ain't something you want to mess with. You want your vascular integrity. You want to make sure those endothelial layers are nice and strong and durable, because heart health is huge.